Welcome to the International Association for Adolescent Health Pioneers project. In this series, we have interviewed a range of experts from around the world who have led the way in promoting adolescent health in their countries, regions, or internationally. We wanted to listen to their stories and share their experiences so that these might be applied elsewhere. The members of the IAH Education Committee were particularly interested in how these pioneers influence the education and training of healthcare professionals in adolescent health. In the following interview, Dr. Francisca Handy is talking with Dr. Rosa Maria Nancho, a pioneer in adolescent health in the Philippines.
Okay, once again, thank you so much for your willingness and for the time that you provided for us to share your story on the development of adolescent health and medicines in the Philippines. And as I search in the Google, I found your name as an adolescent physician at the Manila Doctors Hospital and the Philippines Children's Medical Center. And you are the founding president of the Philippine Society of Adolescent Medicines, which was established in 1997. Yes, together with Dr. Alisita Mesis and Dr. Regina Kailao. I hope I read it right. Okay, so could you share with us how was the history of the adolescent medicines and adolescent health development in the Philippines?
Okay. Well, in 1977, Dr. Fed Del Mundo, she is the very eminent president of the one of the founding pediatricians in the country after she was trained pre-war in Harvard. That was the first time that they introduced adolescent health as a topic in the Philippine Pediatric Society. And at that time, I was a resident in the Philippine General Hospital. So it took my interest because it wasn't something very common yet at that time, in 1977, to be really taking care and focusing on teenagers. So by 1978, when I had finished my residency, Dr. Perla D. Santos Ocampo, who was also, I think, one of the past IPA presidents, wanted to establish a clinic in the Philippine General Hospital. So she tasked me to run the clinic in the Philippine General Hospital. So I was manning it and doing the interviews of teenagers separately we set up a clinic separately from the regular children's clinic. So after that, I had an opportunity to go to the United States to train. But at that time, I think it wasn't yet very much open to foreign graduates to directly go into adolescent medicine as right away as a fellowship. They wanted you to go to residency again, in which I did not want because I had already taken my residency in the Philippine General Hospital. But anyway, I went into psychiatry in the States, in New York. But then after that, I found out it wasn't really for me. Went back to the Philippines, but that training I had really helped actually because there are a lot of psychosocial issues in adolescents.
Yeah.
Anyway, I continued the clinic, and then I was incorporated into the faculty of the College of Medicine, where I started the teaching the theoretical adolescent growth and development to all second-year medical students. So when I had that already experience, we run already the hospital's clinic, and then in around 1989, we set up the fellowship in adolescent medicine. So to set up an adolescent medicine fellowship, you need at least 2 fellows. So I was one of the fellows of the Philippine Pediatric Society, and Dr. Perla D. Santos Campo was the second. So that was the first fellowship training program in the country. So that's how it developed. And so we started training one fellow at a time. And then, so it caught up the interest of the graduating residents, pedia residents. And so we were able to send some of our fellows, like Emma, to train further, to get further training in Australia. Through our contact with Dr. David Bennett. I don't know if you're familiar with Dr. David Bennett, because he's one of the pioneers also in Australia, right?
Yeah. I've heard his name. Yeah. So
he was one of the first trainees abroad.
Dr. Emma.
And then afterwards, I also went abroad through a scholarship to train again further on adolescent medicine in Montefiore Medical Center in New York. It was a scholarship. So when I came back, we combined, Emma and I combined to again train more residents taking fellows who became fellows later on. So that was about it. And then later on, I also helped establish the fellowship training program in Philippine Children's Medical Center. So that was the second fellowship program that we had. So both are government hospitals. So right now we have
both are in Manila or different city?
Both in Manila, but we have already spread our our graduates all the way up to Mindanao. So we have around 26 to 28 graduates already since the time that we had these 2 training programs.
Okay, so the initial step that was established in the Philippines was the establishment of the adolescents clinic.
Yes, it was first adolescent clinic. You just of course you have a separate clinic, a separate room for private interviews, and then a general clinic for the residents and interns to do their basics.
Okay, and the clinic was in the teaching hospital.
Yes, in the
Yeah. So basically, it was start in a very very simple way. To have the specific service for adolescents health, separate service for adolescents patients, and then it continue, and then you continue to have the adolescents education and training.
Right. And,
right.
For one thing, because at that time, initially, adolescents were handled by medicine, internal medicine.
By the adult medicines.
By around 12 years old, you are already moved to the internal.
I see.
So I had to fight with the director to haggle that it be raised to 18 years old and 364 days. So I had to justify it, not to the board of directors of the Philippine General Hospital. So I told them, just give me 18 years and 364 days, and you can have the rest.
Until 1,000 years.
Then just give me 18 years, and you can have the rest.
Exactly. Actually, most of the hospitals in Indonesia are still, around 14. Yeah. So we still have that, journey to accomplish, to fight it.
In the Department of Health, we had to also talk to the Department of Health of the government, because in the government the age grouping was not. It wouldn't jive with the data collection that we wanted. So
exactly.
we had to, present ourselves to the
Yeah,
department,
yeah,
and then mingle with them,
yeah,
and we told them that we will divide adolescents into 3 periods, early,
yeah.
and then so that the statistics would be, for them, because in the Department of Health, it's 10 to 14, and then 15 to 19.
Yeah.
So that's how we.
So you did the advocacy for the national survey to have aggregate age group, during the adolescence period. Wow, that's interesting. I think Indonesia really needs to learn from the Philippines. So, in terms of timeline, if I just want to confirm it with you. So, the SAMPI itself was established in 1997, right? But the adolescence clinic was far before that. When
Yes.
was it start? The clinic, the adolescence health service clinic that you mentioned?
Oh, that was in 1979.
1979.
Yes.
1979. I was just 3 years old.
1979, we already established our first adolescent clinic in the hospital.
Oh, wow. It's amazing. 1979. And then the first education and training program for the undergraduate was around, if I'm not mistaken, around
when I came back from, I was appointed 1982. We started
1982 for the undergraduate
for the undergraduate
medical school. Okay. And for the fellowship program, 19
program started in around, I think, 1991, because we had our first,
1991. Okay.
sorry, 1989, and then
1989. Sorry.
the first graduate was 1991, the first graduate.
So it took around 10 years,
Yeah.
from the very initial step to establish adolescence health in the Philippines in 1979, and then you have a formal fellowship program in 1989.
Yes.
I just really want to learn, the milestone. So because Indonesia, I think we are still in the very early steps of developing our adolescence health and nonsense. Okay, thank you. So maybe I would ask my second question, which is more personal. What has actually inspired you to work in this adolescence health field?
Actually,
Nelly.
I really thought that I was good in psychiatry also. No? So I combined my interest in pediatrics and psychiatry to be able to use it to attend to that selected age group, which was not well attended at the time. No, there was really no focus on teenagers as a select group of with specific concerns. So I really felt that we really needed to attend more to this age group already. So you really just have to want to do something for them so that they can move on, and because our hero, Philippine hero Jose Rizal, always said that the young people are the future of the country. No? So
Exactly.
I really felt that was really very important, that we had to establish, health concerns and attend to the health concerns of this specific age group.
Okay, so basically because it's your initial interest was also like psychiatry, but you said that psychiatry is not really for you. So like the combination of biopsychosocial, as one approach, one holistic approach that really interests for you. Okay, it's interesting that you mentioned also about your advocacy to the Ministry of Health about the having the aggregate subgroup for adolescents in the national survey. Could you share more about that? More specific about it?
Yeah. Well, Dr. Alicia Tamesis and I, at that time, were part of the Philippine Pediatric Society. And because of the interest also of that president at that time, he set up a meeting uh, with with the Department of Health, and we presented to them our point of view and the reasons why we felt that we should build up a separate age group already and emphasize so that we will jive in how we were reporting cases to them, because we report our cases to them, no, as part of the statistics. So we had to sort of like coordinate with that. But so it wasn't very difficult at that time to convince the department. So as long as we we had that age group that we said that we should define the adolescents. So for adolescents in the Department of Health, it's 10 to 19 now. No? So and that is whenever you report, it's like that, 10 to 14 and 15 to 19. So by the time that the it was in I forgot what year, but they asked me also to help them develop the adolescent job aid for them. So the first adolescent job aid of the World Health Organization was adapted locally.
Ah,
We did a local adaptation of the adolescent job aid
yeah,
for
yeah,
the
yeah.
and that's what we use to train our local health centers, the doctors or the nurses who handle, teenagers in the rural unit, so that they
For
can,
the primary care.
yeah.
Yeah.
So that's where, and Emma is doing the second version now, which is the online training. But the original that we started was the handbook. It's a handbook
Yeah. So,
for
uh,
the
in the Philippines, who do mainly the advocacy on adolescent health? You have SAMPI and you have other maybe other organizations, professional organizations that related to adolescent health, or
adolescent health. Actually, when we established the Society for Adolescent Medicine of the Philippines, or SAMPI, it was supposed to be an advocacy group.
oh, I see.
So we can invite priests, ministers, we can invite psychologists, teachers, whoever is interested in adolescent
So
health.
it's
We have
multi-sectoral people.
OBGYN people. So every other year we would have sort of like big conferences on
Mm.
adolescents. So that has been running through regularly. But then we felt that we needed a another society separate from the advocacy group to establish our whole as specialist. So we set up that's
Mhm.
the president, the Philippine Society of Adolescent Medicine Specialists. So we call
Oh,
it,
I see.
and this is the one that's accredited by our Philippine Pediatric Society because it is
Ah,
purely pediatrician.
oh, I see. So you
Uh,
have
yeah,
yeah,
because
specific organization for the specialist.
they will not recognize it. So we have to
Mm.
a PSAM, which means Philippine Society of Adolescent Medicine Specialists Incorporated. And that's
Oh,
the
that's
accrediting
interesting.
body. Yeah, that's the accrediting body. So if
Yeah, yeah.
once they graduate the fellowship, we accredit them after a written and an oral examination.
Okay. Yeah. Thank you, Dr. Nanjo. So, it's been like so more than 4 decades, yeah?
Yeah.
It's been then more 4 decades since the very first initial steps. Could you share with us what are the challenges? You've mentioned some of the challenges, but in general, what are the challenges, especially in the early phase, of the development of the adolescent medicines? What were the challenges that you found as a pioneer?
I think one was to convince or invite more resident graduates to go into that specific fellowship of adolescent medicine because it wasn't really a very attractive
Mm.
specialty,
Yeah.
you know.
What did you
And
do to make it more attractive for them?
well, we had to really conduct traveling seminars to
Ah,
different chapters of the Philippine Pediatric Society. That was one.
like a
So
roadshow, yeah?
yes, we had to go to different and we would set up different topics based on what they would request. And then the other one was to see to it that we always had lectures to residency programs locally. So different residency programs, we would always have that. Initially, we did not have a lot of takers. There would be years where we had no fellows.
Oh,
Yeah. So, but later on,
in, yeah.
yeah. So usually we only have one fellow at a time. After 2 years, sometimes there's a blank year, and then there's another one that would come in. But gradually now, we have a lot. In fact, many of the hospitals from the different provinces, they now send their their faculty to us to train.
Yeah.
Uh,
But yeah, you mentioned about the challenge of to get the pediatric trainee to be interested
yes.
in adolescent health. But how did you develop the faculty member of the adolescence fellowship, the trainer?
Yeah. Well, initially there was just me and Dr. Perla Di Santos Ocampo, and then later on we got Emma already on board. So she was the third person in our faculty, and then gradually more and more already started applying for the fellowship. So when they qualified, we accepted them into the division in the hospital. So right now, Emma, who is the head now of the division of adolescent medicine in PGH, she has at least 4 members of the faculty. Now, I moved on later on when I retired from the Philippine General Hospital. I went to Philippine Children's Medical Center, and there, because it was also going on already as a fellowship program, we now have 7 to 8 members in the faculty. So we are able to train more and more. So thank heavens we're not losing applicants.
Yeah,
So there's
fantastic.
taking now. They have to wait because we can only up at least 2 to 3 per year in the program.
Yeah, it's amazing work. Yeah, a lot of work, I believe.
And then
Yeah.
now trying to set up also in the private setting. So in the medical sector, I'm now making my proposal that hopefully by next year they will already accept and approve the program for a fellowship program, the first in a private hospital.
I
And
see. So it's a hospital-based fellowship
Yeah.
program.
yeah,
That's interesting.
yeah.
Yeah. One of the obstacles that I found here in Indonesia is to, not so many. We have our adolescent health service in our primary care centers in many of our provinces, but most of them have low utilization. So there are not so many adolescents coming to the services to use the services. Did you ever had a similar obstacles? Yet to that you really need to develop the demand from the society.
You have
Could you share about that?
that is more of the work of the Department of Health. That's why we have to train first the personnel. Because if you don't train the personnel, then they will, some teenagers will get turned off, and then they also don't know. And then the second one is to establish an adolescent-friendly health facility. You really have to set up certain health-friendly facilities in the LGUs, in the local government, because once they see, you have to advertise it, you have to put time schedules, the characteristics typical of an adolescent-friendly health facility. You have to really describe it, raise the personnel who will run it, and so that the teenagers will come. And then one very helpful thing is establishing peer group, young people as a, as youth peer. Huh? They are the ones who will invite their own peer to come in to the facility to avail of the services. So once that happens, then more and more will come in.
Yeah, exactly. So basically, you need to develop the supply side first. You need to make the service available,
Yeah,
and yeah, has a it's a with different approach to adolescent patients, and develop the youth meaningful participations. Yeah, to the
yes.
service itself.
Even
Okay.
in school, yeah, in schools also you can do that. No, so you have to train either the school health physician, no, or the guidance counselors to establish friendly clinics in
Yeah,
their.
exactly. Involving school is very important because most of the time adolescents are at school. Yeah, at least for 8 hours in the day life. Uh, could you share more about how is the adolescents school based service in the Philippines?
Right now, it is not yet well established, I can see. Um, that's why now we are involving the Department of Education to learn more how to run adolescent-friendly health facilities. Um, so it is really starting with the training of the uh, facilitators or the health what do you call it, the health personnel. So at least now the Department of Education has its own module on adolescent medicine.
Ah,
So
that's
yeah, they have
interesting.
already, and it is mandatory for the nurses, school nurses, and school physicians to
Ah,
take it.
okay. So you have a specific specialization for school nurse and school doctors in the Philippines.
Um, I don't know. They are hired by the Department of Health, but they are, the for it to be friendly, they have to now learn how to. We have
Yeah,
foundational courses
yeah,
so
yeah,
that they will learn how to
yeah,
interview, the head's history, and
yeah.
physical examination, things like that. So once they are able to do that, then we advance them to this AJA manual or online courses, which we are
Okay.
going to launch hopefully next year.
That's interesting. So mentioned that the Department of Education has its own module. So the ownership really in the education sector. That's really
Yes,
interesting. Yeah,
yeah.
yeah,
You have to really work with the government.
exactly.
Oh yeah,
Yeah,
very.
exactly.
But
Exactly. Okay, so maybe this is my very last questions. Could you share the critical point, the lesson learned, the critical point of the lesson learned that a country like Philippines, similar to Philippines, Indonesia very similar to Philippines, and maybe other countries around the globe also. What can we learn from country like Philippines to develop its adolescents health and medicines service and also environment?
you have to first respect your own culture. You have to always consider the culture of your country. And then secondly, you cannot work alone. You have to work, and it will also start with adolescents themselves. You have to convince them, give them a role and participation in developing programs for your whatever programs you want. And then I think if you just have the verb and the eagerness to fight for what you really believe in, especially for the adolescents, then I think that you can convince your government. So it's really important that the government comes in
Yeah.
It's not just a private, so because the bigger is really the government. So try to work with the government.
Yeah. Thank you so much for the time and you for taking the very nice story and highlight the lesson learned that we can all learn from the Philippines. And you mentioned very clearly about the respect our own culture, yeah, respect our own country. So that is why adolescents health service in each country has its own specification. Yeah, there's no such very similar service,
Yeah.
yeah, in every country, yeah. And yeah, the other important two issues is the youth meaningful participation and collaborative work among all sectors, related sectors with adolescents. Thank you so much, Dr. Rosa Marionancho, for this wonderful interview, and thank you for your hard work since 1979. So it's almost more than 4 decades, almost my age. I'm similar to my age.